Hello, my name is Asia and in this video, I will discuss how I would manage a psychiatric crisis involving a young postpartum patient representing with symptoms suggestive of postpartum psychosis. The patient we have here is a 19-year-old woman who recently gave birth 2 months ago. During today's visit, she presents with several concerning symptoms, including rapid and tangential speech, unusual beliefs about her baby, and grandiose ideas about world peace. She expresses a belief that her baby may be an alien and states that she needs to take the baby to the desert and leave it on a mountain so that the aliens can retrieve it. She's also been making plans to go camping with the baby. These statements itself strongly suggest that the patient is experiencing delusional thinking and impaired reality testing. Although she denies suicide ideation, she also denies homicide ideations. Her beliefs about the baby create a significant safety concern. Postpartum psychosis is rare, but it is a serious psychiatric condition that can occur after childbirth. It's also considered a psychiatric emergency. Postpartum psychosis often presents with symptoms such as hallucinations, delusions, disorganized thinking, mood instability, and impaired judgment. Patients experiencing postpartum psychosis may develop delusions involving their baby, which can increase the risk of harm to the child. In this case, the patients believe that the baby is an alien and needs to be returned to aliens, demonstrate a dangerous distortion of reality. Another concerning factor: the patient has been acting differently for the past 2 weeks, according to her husband. Sudden behavior changes, especially in the postpartum period, it does raise concern for a serious psychiatric disorder. The husband also reports that he is afraid to leave her alone with the baby, which further indicates that there may be a risk to the infant's safety. So, right now, our immediate priority in this situation is the safety of both the mother and the infant. I will ensure that the patient and baby remain in the clinic while a crisis intervention plan is initiated. It will be important to involve the husband in the conversation and ensure that the baby remains in a safe environment while the patient receives evaluation. Because the patient is experiencing delusions involving potential harm to the infant, she meets criteria for emergency psychiatric evaluation. In Louisiana, a PEC can be initiated, which is a physician's emergency certificate. This is when a patient poses a danger to themselves or others due to mental illness. In this case, the patient's delusional beliefs create a potential danger to the baby, even though she does not express direct homicidal intent. Emergency psychiatric hospitalization would be necessary to stabilize this patient and conducting a comprehensive psychiatric evaluation. Inpatient treatment would allow healthcare providers to monitor symptoms closely and begin appropriate treatment. Treatment for postpartum psychosis often includes antipsychotic medications, mood stabilizers, and close monitoring of sleep patterns and mood symptoms. Postpartum psychosis can also be associated with bipolar disorder, so a full psychiatric evaluation is important in determining the most appropriate treatment plan. It is also essential to provide education and support to the patient's husband. Family members often feel overwhelmed and frightened when witnessing sudden behavior changes like this. Explaining that postpartum psychosis is treatable, it's a treatable medical condition, and it'll help reduce its fear. I will also encourage the family to involve themselves in the treatment process. Postpartum psychosis requires urgent treatment because it carries a significant risk of harm to both the mother and child if it is left untreated. Early intervention is always best, and hospitalization. It can improve the outcomes and help ensure the safety of the family. If if this patient is hospitalized now, it could prevent something from happening once the patient leaves from here, being that she is currently having these delusions. In summary, this patient presents with symptoms consistent with postpartum psychosis, including delusional beliefs, disorganized thinking, and impaired judgment involving her infant. So, hospitalizing her and getting her immediate treatment for the safety of the both of them is extremely important. Because these symptoms place the infant at a potential risk of harm, immediate psychiatric hospitalization is necessary. Baby can be safe with father, and while the mother is hospitalized or PC'd and receives treatment. The primary goals of treatment are stabilization of the mother, protection of the infant, and initiation of appropriate psychiatric care. Once mom is hospitalized and there's further evaluation, she can be treated with medications and psychotherapy to help her overcome her delusions so that she can return home to baby, and we can follow up with appointments to continue our psychotherapy.